Welcome to our quick guide on heparin, an important medication from nursing practice. Let's dive in. Heparin is an anticoagulant, which is used to prevent the clot formation. It is indicated in conditions like deep vein thrombosis, pulmonary embolism, acute phase of MI, and it is also widely used for the prophylactic measures to prevent post-operative thrombosis, for example, in hip replacement and the prosthetic devices like heart valve replacement. Heparin and its low molecular weight derivative like enoxaparin does not cross placental barrier, so they are safe to administer to pregnant females with prosthetic devices. It is really crucial to monitor the APTT values or the activated partial thromboplastin time for the patients on heparin. The normal range for APTT is 30 to 40 seconds, and if patient is on heparin, it is 1.5 to 2.5 times to the normal range. And if it gets beyond, patient will be at high risk for bleeding. An antidote for the heparin is protamine sulfate. Remember this for your exam. From NCLEX point of view, remember to educate your patients about the early signs of bleeding, like easy bruising, blood in urine. Remind them to report any unusual symptoms and to avoid activities which will lead to the injury, for example, contact sports. That's a quick rundown on heparin. Stay tuned for more nursing tips and don't forget to hit like and subscribe. Thanks for watching.